Julian Castro from the Department of Housing and Urban Development, again to discuss the fiscal year 2016 budget request. The goal today is to frankly dive a little bit deeper into the specifics of what HUD is requesting for each of the different programs in 2016. Mr. Secretary, we appreciate your testimony today as we take a closer look again at the FY16 request. And we do have your written testimony, obviously, and it has been entered into the record. Because we have a significant amount of ground to cover and limited time, and in coordination with the ranking member, we're going to dispense with the delivery of opening statements, and instead we're going to move straight into questions. So we will begin with, again, the 5-minute round, and again, everybody here has been very cooperative. So obviously, just a reminder, when you're posing your questions, please allow some time for the Secretary to provide an answer. That's always helpful, isn't it, Mr. Secretary, when you're actually able to answer some of the questions that we have. So with that, let me start with, yeah, please, start the clock. In February, the HUD Inspector General reported that your agency paid more than $37 million in subsidies to tenants who were not compliant with community service or self-sufficiency requirements, et cetera. So once again, and we had this conversation before in the last hearing, so if you see that this is something I'm concerned about, and I know you're concerned about, the IG has found a pattern of non-compliance among PHAs, and then minimal oversight by HUD. So this report suggests really a systematic failure rather than just a few isolated incidents. Would you agree with that? And if so, what steps is HUD taking to correct, again, this very basic failure to comply with basic community service and self-sufficiency requirements by the PHAs and some of the tenants as well?
Thank you very much, Chairman, for that question. You're correct that the IG did make some findings. I'm confident that the vast majority of housing authorities out there that bring peace do follow the rules, make every attempt and successfully follow the rules. However, as the IG noted, there are some gaps there. And I want to let you know that we do take this seriously. We understand that these are programmatic requirements, and we want to ensure that we follow. The IG has made some recommendations. I want to let you know today that we are follow those recommendations and implement them to ensure that the requirements exist, that they are met. We look forward to providing an update in the future.
That'd be great. That'd be great, Mr. Secretary. And again, because as I mentioned, it's not a, you're right that obviously most people do comply, but the IG found that of the 550,000 covered by the requirement, 106 units had that problem. So it's a pretty big issue. It's not an isolated issue. So I do look forward to updates as you go forward. Your budget request adds $512 million in additional TBRA funding to replace the thousands that we all heard were lost to sequester. And by the way, as you know, I'm newer on this chairmanship than you are to your position, so I'm still learning. But the 2015 TBRA program that will help, it's actually going to help 42,000 more households than it did the year before sequester. We can talk about sequester. You know, I'm one of those who believes that sequester needs to be replaced, but just to get the facts on the table. So we haven't lost vouchers since sequester, actually. We have gained thousands of them. So what am I missing when you actually look at the numbers? Again, 42,000 more households than we did the year before sequester. So am I missing something?
I would just say a couple of things in terms of our request. The first is that what we see out there is a growing need. In our latest worst-case housing needs analysis, we found that there are 7.7 million low-income households that are either paying more than 50% of their monthly income in rent or living in substandard housing, or both. What we also saw during sequester was that there were about 70,000 vouchers that housing authorities had authority to let out that they had to pull back on. And so the request that we have in front of the committee asks that about 67,000 of those vouchers are restored. And we do that, we accomplish that with certain special purpose vouchers. We're going this route because we see specific need out there for the use of vouchers around the country, and also because, and I want to give credit to the committee and the work of this Congress as well, through the allocation of HUD-VASH vouchers and HUD's and VA's work on this, we've learned some lessons about how we can specifically implement vouchers and drive down homelessness among certain population groups that are particularly needy.
Great, and again, I look forward to working with you. Just as you know, we've increased $1.4 billion since 2013. So the money has been there. I mean, you know, with sequester or not, and again, 42,000 more households. So, but anyways, we'll continue to work with you to make sure that we can do as much as we can with whatever allocation we get. Now, let me recognize the ranking member.
Thank you, Mr. Chairman. Mr. Secretary, welcome back once again to go a little more fully into your budget request and to housing and community development efforts that you're making. I'm pleased to see a healthy request. I think in the current environment it counts as a healthy request, $250 million for choice neighborhoods. That's the successor, as you know, to the popular, successful Hope 6 program. To provide some perspective on that, though, the funding for Hope 6 has varied from $625 million in fiscal '99 to $80 million in the current fiscal year. At that latter level, you wonder if we still have a national program. So you're bringing it back, or you're proposing to bring it back. We know that when we allow our public housing stock to go into disrepair, entire neighborhoods are affected. They become susceptible to blight, socioeconomic isolation, high concentrations of poverty and crime. Hope 6 uniquely, and I stress uniquely, address the problem of distressed public housing by taking a comprehensive approach, revitalizing whole communities. I've seen this program firsthand, transforming, for example, Few Gardens in Durham, Halifax Court in Raleigh. In fact, I think most of us probably have Hope 6 success stories in our districts, and we also know the work isn't yet done. Recent funding levels have allowed HUD to fund only 10% of its implementation grant application and 17% of the applications for the newer, less generous planning grants. So the need's there, yet Congress continues to short fund the program year after year. I hope we can reverse that trend this year. I want to ask you two questions. Please provide the committee with an understanding of the number of public housing authorities that still have severely distressed public housing units, and comment on the level of need and interest relative to the funds that you have available. Secondly, because the Public Housing Capital Fund has been woefully insufficient in keeping up with the capital demands, Choice Neighborhoods has become functionally the only source of funding, in many cases, for large-scale modernization, demolition, and replacement of our nation's public housing stock. So given that situation, how can we best utilize our limited resources to ensure that our nation's blighted housing stock is in fact replaced and revitalized and replaced?
You really hit the nail on the head there, Ranking Member Price, with regard to the need that we see that exists out there and the purpose of the Choice Neighborhoods Initiative, and prior to that, Hope 6. The approach here is to try and break down the silos that often exist in the federal government and in local communities around not just improving the bricks and mortar, but lifting up the entire community, making the community safer, ensuring that there's a mixed income community, looking at education as part of this, and providing other services. That is the true value of the Choice Neighborhoods Initiative. Our request is for $250 million. In FY15, it's being funded at $80 million. What we see out there, though, is a tremendous amount of need. We have many older housing communities that still fall into the model of an aggregation of poverty that research after research has shown is not the best approach to achieve better educational outcomes, and frankly, to get folks up and out to a more successful place in life that they want to be. So this request, we believe, would allow about 6 to 10 choice implementation grants, with the rest being planning grants. I know from firsthand experience.
That's relative to a demand. Can you quantify that as well?
I can get you, certainly, I don't have the number of applications, for instance, that we got in the last choice round, but that's a number that we can get you. I can't say that every time we go out for one of these planning grant rounds or implementation grant rounds, there is tremendous demand out there, and would be happy to get you more specific numbers in terms of the number of applications versus the number of awardees.
Good.
Suffice it to say that that is a very significant demand that we see. In fact, just about every mayor that I meet with asks about choice neighborhoods, no matter what part of the country they're from, because they have these older housing communities that could sorely use this kind of investment.
I know your time's running out. Maybe we'll go over to the next round on the question about the blighted public housing stock and the de facto situation that's emerged in terms of choice neighborhoods being basically, with the public housing capital funds depleted, choice neighborhoods becomes, in many instances, the only choice. We'll take that up on the next round.
Thank you, Mr. Chairman, and good morning, Secretary Castro. Nice to see you. You know, I have a couple questions here. The first, in the cost of renewing projects under your homeless assistance grant program, they continue to grow, and I'm concerned the growth is not sustainable. We can't afford to blindly renew these projects, regardless of their performance, just as they were funded in the past. So I was wondering, Mr. Secretary, what are you doing to help grantees identify lower performing projects that should not be renewed?
Yeah, thank you very much for the question, Congressman Joyce. We want to ensure that we're always trying to be as efficient as possible. And so one of the things that I'm most proud of HUD over the last several years is that we've gotten a lot better, for instance, at technical assistance to our grantees so that they can become more efficient. In fact, as part of this budget request, you'll see that we propose from different program areas merging $120 million into what we call our transformation initiative, which supports common technical assistance. If there are particular concerns that you have that you've seen in your district or others, we'd be glad to take that up. But we want to ensure that we reach a level of efficiency with these projects, that is due.
In 2014, less than half of the continuum of care grantees reallocated renewal funding from low-performing projects. Shouldn't all grantees be doing this?
What was the question again?
The less than half of the continuum of care grantees reallocated renewal funding from low-performing projects. Shouldn't all grantees be doing this? As far as what is HUD doing to make sure every grantee is getting their money based upon performance rather than just getting a grant renewed because it was there in the past?
That is something, I believe that under Secretary Donovan, we started to move down the road of measuring outcomes better. And we have the opportunity when we work with the continuum of care around the country to do this because this is a competitive process. And so it's incumbent upon the continuum of care, but also HUD in this competitive process to ensure that the best performing entities are getting that funding. And that's something that we continue to work on. We have regular meetings on how we can ensure that these dollars are prudently spent and have as big an impact as possible, and would love to follow up with you on a discussion of that.
I appreciate that. And one more. Will you require all the grantees to collect performance data next year? And will HUD also require the funding decisions be based upon that data only?
I believe that it's fair to say that over time that's the direction that we're moving in. We see this issue as well with regard to our negotiations on the moving to work agencies, for example. We're looking right now at extending moving to work contracts beyond 2018, and one of the points of negotiation is what kinds of metrics will be included in those contracts. In the same way, with each of our grantees, I would say as someone who has been new to this over the last 8 months, we still have a significant amount of work to do to ensure that when we outlay revenue, that we get the performance that we want. So I can't promise here that in the next year we're going to get where we want to go, but I do think that we're moving in that direction.
I appreciate that. I'm not sure how much more time I was going to... Well, I'll just defer until my next round of questions. I have some other questions. For the
Thank you.
Secretary.
With that,
Thank you, Mr.
we'll recognize Mr. Quigley.
Thank you, Mr. Chairman. Mr. Secretary, welcome back.
Thank
Good to have you. And I can't put my finger on it. You just remind me of somebody I work with here. I'm sure it'll come to me before the day is over.
He's not quite as good looking as
No, that was my first thought. You, on the question from the chairman, we're talking about the importance of restoring vouchers. I'd like to give you the opportunity to elaborate as it relates to specific populations, populations that are very concerned about this in my district: domestic violence victims, homeless families, veterans, tribal families, and again, survivors of domestic violence.
Yes. In fact, the focus that we have this year on our request for special purchase vouchers is very meaningful because it does relate to several populations that we see with a particular need in terms of housing choice vouchers. So one of them that you mentioned, for instance, is we have a request for 4,900 new vouchers for victims of domestic and dating violence to assist individuals who are currently living in circumstances that really they need an out of. And this would give public housing authorities out there the opportunity to have some vouchers that are at the ready that would be administered actually from headquarters based on need, but that we believe are very necessary to meet a need out there. Another example is family unification vouchers. We're requesting $20 million for what would be 2,600 of those. Those would be distributed by competition. One of the things we're excited about, for instance, is a proposal to allow youth who are in foster care a 5-year time period in which to still make use of these vouchers. Right now, that's limited to 18 months. And we have seen clearly that that's just not enough time, that folks need more time to be able to get on their feet and settle into a place in life where they can be self-sufficient. Another example is vouchers, about 22,500 that would be available for homeless families, veterans, and Native Americans, and individuals who may have in the past gotten a HUD-VASH voucher, but we're not making a request for HUD-VASH in fiscal year 2016. Remember that our goal is to effectively end veteran homelessness by the end of 2015, and we're working very hard to reach that goal. However,
How close are we?
We're aiming to end it by the end of this year, and we made significant progress. The last number that we had was in the 2014 PIT count, we were at about 49,000. The 2015 PIT count was just conducted between late January and early February. We'll get the new number in the fall, and then we'll get the 2016 count that will happen early 2016 in the fall of 2016, and we will know what that number went down to. However, I brought that point up because this set of special purpose vouchers would be allocatable to veterans, including on Native American reservations, if there is still need at that point for those, and would also be allocatable to veterans who were other than honorably discharged from the military. So we have some veterans, for instance, that over time may have been discharged because of the don't ask, don't tell policy. And so right now their discharge status says they can't receive a HUD-VASH voucher. This would allow them.
What was their status, do you know, when they were discharged for don't ask, don't tell?
It's a good question.
I'll find out.
But these individuals and others received an other than honorable discharge.
Right.
It wasn't an honorable discharge. And we believe that there is a population of veterans there who ought to be eligible for voucher funding. And that would be included in our request for these special purpose vouchers.
Thank you. Mr. Chairman, I yield back.
Thank you, Mr. Valdez.
Thank you, Chairman. Thanks, Secretary. HUD resources such as home and CDBG are vitally important in rural areas, including my hometown of Hanford, California. Unfortunately, many rural communities and small cities do not receive grant allocation, therefore must compete in statewide programs. In fiscal year 2016 budget, the request decreases funding for these programs. Additionally, because funding is inconsistent and unpredictable from year to year, it is incredibly difficult for rural communities to plan and develop much-needed housing and community development projects. What can HUD do to ensure that programs such as home and CDBG are able to work better, more consistently, to provide rural communities with the support they need?
Yeah, appreciate the opportunity to address this. As I may have mentioned to the committee briefly last time, and I know that I mentioned to our Senate committee, our title is the Department of Housing and Urban Development, but truly we are the Department of Housing and Community Development, because we do a lot of work in tribal communities and in rural communities. So to address the question that you had, for instance, about CDBG and home, 30% of our CDBG resources go not to local entities, entitlement communities, but to the state, to be distributed to non-entitlement entities. And about 2/3 of that funding goes to rural communities. With regard to home, 40% of home funds go to the states. Now, that 40% that goes to the states can be distributed either to entitlement communities or non-entitlement communities, but a good amount of that goes to smaller communities. What we see out there is that the biggest challenge for rural communities often revolves around capacity. So we've tried to build up capacity through technical assistance, also through making our rules flexible, or trying to create more flexibility, for instance, by allowing statewide community housing development organizations, or CHODOs, to be designated as eligible for a 15% set aside for rural communities. Right now, 15% of home funds are set aside for a community to work with a CHODO, but oftentimes in these rural communities, there is no CHODO in that rural community that qualifies there, that is eligible. So we say, well, why don't we allow a statewide CHODO to fill that role so that they can make use of that 15% of the resources. Another challenge with CDBG revolves around overhead costs. We propose that smaller rural communities be able to essentially co-administer CDBG funds so that they can reduce their overhead costs and make more use of the funds to do actual investment in infrastructure and in housing. These are some of the ways that we're trying to make it easier for rural communities to make the most of what has been, frankly, tightening resources with regard to CDBG and home over the last few years.
I appreciate that. Turn the mic back on, sorry. Although the low-income housing tax credit is a primary source of financing for affordable rental housing in rural America, the tax credit alone is not enough to make projects affordable in many rural communities. In many cases, other targeted programs, such as the home program, must be paired with the tax credit in order to serve poor rural communities. Historically, home has been the critical funding source for projects in smaller communities within my district, such as Lamont, McFarland, Wasco, Arvin, and Early Mart. In addition to reductions in home appropriations, cuts in USDA funding and for rural rental housing loans have left rural projects with fewer resources to compete effectively with low-income housing tax credits. Due to diminishing resources in HUD and USDA program appropriations, what can HUD do to help rural communities make the most of the resources provided to them in order to build and preserve their affordable rental housing stock?
Well, and let me just add one more tool that is going to be in our toolbox. As you're aware, recently Director Melwatt instructed that the Housing Trust Fund would be implemented in the coming year. And HUD has set about figuring out how to implement that rule. Under statute, each state is to get about at least $3 million from that housing trust fund. You mentioned rental affordability, for instance. 80%, at least 80% of that housing trust fund money will go to increasing rental affordability options for extremely low-income individuals in urban and rural settings. And so the states will have an opportunity with housing trust fund money to look at these challenges that rural communities face, in addition to what I mentioned with adjustments to home and CDBG that we have proposed. The National Housing Trust Fund provides one more tool to create more affordability.
And thank you, Mr. Secretary.
Thank you.
Thank you. Mr. Correa, you're next, but
To the ranking member of the full committee.
great. Mrs.
Madam
Lowy,
Lowy.
pleased to have you here. You're recognized.
Thank you very much, Mr. Chairman. And before I get to my questions, I'd like to welcome the distinguished secretary. I thank you for being before us today. And before I get to my questions, I think it is essential to acknowledge the backdrop for this discussion, the House majority's efforts to pass an unrealistic, an unwise budget resolution. As my colleagues are no doubt aware, the House leadership intends to consider a budget resolution this week that barely made it out of committee because of an ongoing dispute about the sequester-level budget caps on defense-related activities. I understand and share their concern about the budget caps being insufficient to adequately fund these priorities. I only wish there were similar concerns by my majority colleagues about all of the priorities on the other side of the ledger that will also be dangerously underfunded if we do nothing about the budget caps. To that end, I was very pleased to see the President's request for HUD calls for an increase of $5.4 billion over last year, bringing its total to $41 billion. But even at this level, we still have not kept pace with actual needs. We still would be below the amount we appropriated in 2008, 7 fiscal years ago. Now, one of the areas where I have worked, and I know there's still a great deal of concern, the partnership between HUD, EPA, the CDC, and state and local partners has been successful in reducing childhood lead poisoning. In 1997, more than 7% of children tested positive for elevated blood levels. By 2013, that rate was reduced to less than 1%. Lead poisoning takes a significant toll on the educational achievement of children, and children with elevated blood levels are more likely to have slowed growth, learning difficulties, and development delays. Does HUD ensure that grantees work with schools and early childhood education providers to identify potential cases of lead poisoning? And if you could describe how the Healthy Homes and the Lead Hazard Control grants work together, and if you could anticipate for us the scale of the work that remains to be done. Thank you.
Sure. You bring up a very good point, and one that strikes at the basic connection between housing and health. And with regard to your question on working with local educators, we do recommend to our grantees that they include local educators in outreach plans. Now, of course, the outreach is formulated at the local level, but that is something that HUD recommends because we know that oftentimes these issues are caught at school with symptoms that come up, and a school nurse or a teacher is involved in identifying early signs of lead exposure. So that is something that we recommend to our grantees. Since 2012, our lead hazard control grants have included the option for grantees to request funding for healthy homes and remediation work. And most of those grantees have done so. So that is where we make the link as well. There is plenty of need that is still out there. I believe that the last figure I saw was that there are 23 million homes that have lead-based paint hazards out there. It's safe to say that the resources that we have are not nearly sufficient to meet the need, and that makes it more important for us to stress local outreach and partnership, and then secondly, to link up our grant programs so that they work together to make as big an impact as possible. And that's what we're trying to do.
Well, thank you so much, and I hope we provide the resources to enable you to do the job. It's hard to believe that there are still 20 million homes. I think that's the number you just mentioned.
23 million. Yeah.
And plenty of children in those homes. So I thank you very much. Thank you, Mr. Chairman.
Thank you, Ms. Lowy. Mr. Cuellar.
Thank you, Mr. Chairman. Mr. Secretary, it's good having you again. Good seeing you again. Tell me about your efforts, what HUD is doing to leverage public-private partnerships. In particular, I want to see what you're doing to rebuild the nation's affordable housing stock. I do know that y'all are making a proposal for RAT, the Rental Assistance Demonstration Program. In fact, that's one of the things I submitted to the chairman yesterday. We had a deadline yesterday, but if you can explain to us what specifically do you have in mind?
Yeah, so the Rental Assistance Demonstration project, which came into being, I believe, in 2012, a couple of years ago, is an innovative approach to address a glaring need that we have out there. There's about $26 billion in backlog of renovations and repairs that we need to our 1.1 million units of public housing. And we're losing about 10,000 units of public housing to disrepair every year. RAD essentially takes traditional Section 9 housing and through public-private partnership turns that into Section 8 financed improvements to that housing. And we have authority under the fiscal year 15 budget to do about 185,000 RAD conversions. We have applications, or actually we've awarded about 183 of those, 183,000 already. And we have done 134 deals out there that have equated to just over 13,000 units under what's called RAD 1, the first component of RAD, and another 8,700 units already under what's called RAD 2. What we see is, number one, this is an effective public-private partnership to renovate units that otherwise probably would not get renovated for a long time, if ever. In fact, in a small town called Lexington, North Carolina, the housing authority there said that they were going to be able to do 58 years worth of work in 22 months. That's the kind of acceleration that we can get when we involve the private sector smartly in these conversions. Secondly, we commissioned a study last year by a neutral third party that found, it looked at the first 57 RAD deals and found that for every $1 that was invested by the public sector, $19 were invested by the private sector.
Say that again.
So it found that in the first 57 RAD deals, for every $1 we invested from the public sector, $19 were invested by the private sector.
That's a pretty
That's
good
having
return.
a tremendous impact, and doing it in a way that that I believe will ensure that more units of traditional public housing are suitable for living, meet basic quality of life standards, and avoid continued cost to the taxpayers.
Okay. Well, thank you for your leadership on including the public-private partnerships. I think it's a pretty good investment. It really is.
Certainly. We're excited about it.
Yeah. Mr. Chairman, I have more questions on colonias, but I'll wait for the second line of questions, so I'll yield back the balance of my time.
Thank you. Let me go back to Mr. Secretary, let me just go back to the line of questioning that Mr. Quigley started about these targeted population vouchers. And what process will HUD be utilizing to allocate these new vouchers? And will you need to issue regulations to implement these new vouchers or not? And also, how long would that take?
Yeah, for the 4 types of special purpose vouchers, there'll be a couple of different approaches that we take. There are some new regulations that are involved in these. For instance, in fact, today we're releasing new regulations that are a follow-up to the Violence Against Women Act from 2013 that will touch on as well this issue of special purpose vouchers for victims of domestic violence. With regard to the 22,500 vouchers for families, veterans, and Native Americans, that's the $177.5 million request. Those would be distributed by competition. And so, of course, we'd formulate the terms of that competition. The 37,000 new need-based vouchers that we've requested, which is a $277 million request, would be allocated by a method that captures relative need, determined, yes, by one of our rules. And then...
Is that a new rule you would have to implement, or is that current? Do you know?
Let me... Yeah, it is a new rule. Our PD&R department would set that formula
All right,
for
so you'd have
allocation.
to start that process.
With regard to the 2,600 family unification vouchers, that would be done by competition, and so we would set the terms of that competition. And with regard to the 4,900 domestic and dating violence, I mentioned that that's being determined as well right now.
No, I'm assuming that it costs more to do these type of vouchers than just adding more regular housing vouchers. Any idea what the cost is associated with doing it, this way versus just a regular, if you just were to add more, regular vouchers?
I don't believe that the administration of this is appreciably different from the administration of our other vouchers, because the grantees are often the same, Housing Authority, for instance. Would be glad to follow up
That'd be
with
great
you
if you could just
on
look at
an
that.
analysis of whether we think there is going to be much of a difference.
Perfect.
But it's fair to say that there are special vouchers in place right now. HUD-VASH is a good example that are broad housing choice vouchers. So in terms of the added administrative cost, I don't believe there would be an appreciable difference, but we'd be glad to follow up.
That'd be
with
great.
you on
Thank
that.
you, thank you, Mr. Secretary. Let me kind of switch the subject in the 2 minutes that I have. The 2015 HUD THUD bill and the Federal Appeals Court soundly rejected HUD's attempt to administer performance-based contractor funding as grants. And HUD's own analysis demonstrates that recompeting these contracts could actually save potentially up to $100 million. I know that's not a number written in stone, not to mention the millions of dollars that the courts, that we're spending, as taxpayer money is being spent on the court. So what, with resources under HUD, frankly, already under pressure, how can we justify all of this waste? Again, this is something that the committee has not wanted to do, the courts have rejected it, and we continue to spend money on trying to do this.
This is an issue, of course, that is still the subject of litigation. And this really strikes at a disagreement that HUD had with the GAO over what our most effective method of PBCA would be, and also how effective we believe the procurement process is versus the process that we've used in the past. We believe that the process that we have in place, that we have had in place, our relationship with these state entities who are performing on these contracts now is a good one. They've had good performance, and we also believe, and this is one of the legal issues, that the statute that is in place requires HUD to do this. So that is something that is in front of the court right now, and we understand the disagreement that has been had, but we do believe that we've captured the best method to do this.
And my time's running out, Mr. Secretary, but again, just according to HUD's own analysis, supposedly we could be, recompeting could save a ton of money, potentially up to $100 million. I think that's a pretty serious factor to consider. Mr. Price.
Thank you, Mr. Chairman. Mr. Secretary, I want to turn to the Section 202 and 811 programs, but I first want to give you a chance to respond to my first question in the first round, which had to do with the interplay between choice neighborhoods and public housing capital funding. Just to provide a moment of additional context, the current funding for public housing capital expenditures is $1.88 billion. The fiscal 16 request is only slightly more, 1.97. The historic high is $3 billion, and the estimated need is $3 billion. That is just to stay even. Just to stay even. The dollars required to maintain the existing public housing stock, to maintain it, $3 billion. Now, you're requesting less than $2 billion. So that's the context for my question about how far these funds have slipped, how they're woefully insufficient for keeping up with capital demands. So then, does Choice Neighborhoods become the functional equivalent, or at least the only source for funding large-scale modernization and demolition and replacement of the public housing stock? Is that partly what we're dealing with here in terms of the Choice Neighborhoods demand?
Choice Neighborhoods is one option, and it's an important one, particularly because, as we discussed earlier, it's a comprehensive improvement to the quality of life of a community. It's not just about the bricks and mortar. However, as you say, there is a significant challenge with the bricks and mortar and repair and renovation. The other option is the one that I mentioned in response to Congressman Cuellar's question, which is our rental assistance demonstration project. And we were pleased to get the cap lifted from $60,000 to $185,000. In this fiscal year, we asked that that cap be lifted entirely so that we can, in a smart way, engage the private sector as well in improving the many units out there that do need significant renovation. This is a smart way that I believe that over time we can accomplish what we would otherwise not be able to accomplish given the limited funding that we have received. You're correct, Ranking Member, that there has been diminishing investment in our public housing stock, and that has significant impact on our ability to meet the needs out there and the quality of life of residents. And so Choice Neighborhoods is one great option. Another sound option is our rental assistance demonstration project.
And I would say a third sound option is to give decent funding to the Public Housing Capital Fund.
That would be our preferred option.
That would be pretty
Yeah.
obvious, I suppose. All right, quickly to Section 202 and 811. This is another highlight of your budget, increased funding for these programs. Again, most of us in our districts are well aware of the importance of these programs. How 202 for the elderly, 811 for the disabled, not only guarantees shelter for some vulnerable populations, but provides supportive services to ensure greater inclusion in the larger community. Now, there's been a marked decrease in production of units under these programs, both of them, in recent years, and you're proposing to reverse that troubling trend. Good for you. So I want you to describe, if you will, your Section 202 and 811 requests, how these funding streams will directly affect housing opportunities for vulnerable Americans. And then there are a couple of questions I want you to drill in on 811. There's been a shift toward vouchers in the Section 811 program. In light of that, how can HUD ensure that the partnership between HUD and the states and the developers achieves the goal of creating new units of housing for the disabled? And we're also moving away from the group home model. And that raises the question, how do HUD and the states and their partners ensure that tenants are receiving the same or better supportive services, which is very important often for this population, supportive services in this new so-called mainstream model?
Yeah, two enormously important programs for our elderly and disabled communities. With regard to the elderly, what we see out there is the fastest growing population in the United States are these baby boomers who are turning 65, who are officially becoming seniors. And we see over the last several years no funding for new units of Section 202. Our request is for $455 million in Section 202 to take care of existing units, plus an additional $10 million for a Section 202 demonstration project. With regard to 811, we do request additional funding for 700 new units. The importance of both of these programs is that they allow us to really link up housing and health, and to achieve a savings with regard to health care. We believe that there's a significant savings to Medicare and Medicaid when we make Section 202 and Section 811 investments. And that the better we're able to measure that, to capture that, and then hopefully, eventually, integrate that into how we budget We believe that we could save taxpayers. We are saving taxpayers with the programs, and in the future could save them even more. I
Mr.
believe
Secretary,
that,
I'm going to have to ask you to wind it down at this stage. We'll hopefully have another
just
opportunity.
suffice to say that this is something that we see a tremendous amount of need for that is underfunded right now.
Thank you. We'll return to the topic.
Thank you. Mr. Joyce.
Thank you, Mr. Chairman, Mr. Secretary. Yeah, I appreciate the fact that you're taking a new look at some of these different programs and trying to find cost savings and reductions. I'm somewhat new here. I got in with the lesser good-looking Castro. And, but one of the things in your prior career, mine as a DA, that bothers me is vacant, foreclosed, or, homes that become areas for criminal activity, the fact that they also have, bring down the values in neighborhoods. Is there anything in your budget that shows where funding would be to allow for the tear down and removal of these type of homes?
Sure. This is a question that we often get, as you can imagine, particularly given the housing crisis that we went through. We did have funding a couple of years ago for the neighborhood stabilization program, and that did do a lot of good. However, it's also fair to say that some of our traditional resources, like CDBG, that has flexibility to it, can be used for some of these activities. The other part of this, though, that relates to our budget request is we want to get to a point where we can prevent foreclosure and vacant buildings in the first place. And that's one of the reasons that we're requesting an increase to our housing counseling budget, because our research has shown that, and the research of third parties, that housing counseling is an effective way to prevent folks going into default and then foreclosure. We also have made some adjustments at FHA, for instance, our distressed asset sales program that seeks to get lenders to work with homeowners so that they can stay in their homes. We encourage local communities to look at things like land banks. That's something that we did when I was mayor of San Antonio, so that they can get properties into the hands of folks who are willing to either demolish them and build a new home or renovate what they have there, so that we can create stronger neighborhoods and a better quality of life in those communities.
And I truly appreciate that. I mean, we're doing the same thing. Obviously, northeastern Ohio was hit very hard by the same type of, during the housing crisis. But unfortunately, in some areas, we have blocks of homes that are sitting there that need to be torn down. And I'm asking you, looking forward, do you have any ideas or thoughts on how maybe we can find more money to be available in your existing budget to be able to get this accomplished? I introduced a number of bills, they didn't go anywhere in the last session, trying to get to that outcome. But it's, as you know, I mean, it can really ruin a neighborhood and ruin a community if it's not taken care of.
Yeah, I believe that what the question poses is really, it shines a light on the differing needs of communities that are out there. There are some communities that have a pitched need for this and others not as much. And so that's why when we think about of our existing resources, where do we have the most flexibility for local communities? That's the way I think about it. And so CDBG, home, those are traditional programs that offer a decent amount of flexibility for the communities that do have those challenges to be able to put those resources for that purpose. Now, it is also incumbent upon HUD to give guidance and to work with grantees and to let them know what the different options they have are, because I can tell you that as a former mayor and as a former city council member, oftentimes you may not be aware of all of the different options, and you're not aware that the money could be used for one purpose or another, and so it doesn't get used for that purpose. We believe that through guidance, technical assistance, working with our grantees, where we encounter these particular challenges, they can be met. Having said that, I will say that we do believe that more funding is a positive thing, and that the need out there exceeds the resources that we have in our budget today.
Thank you very much, Mr. Secretary. I will give back whatever time I have left.
Thank you for your generosity. Mr. Quigley.
Thank you again, Mr. Chairman. Mr. Secretary, read recently that HUD is moving forward with an exploratory grant program to assist low-income victims of domestic violence that are living with HIV/AIDS. I understand that these funds will be available to make awards to about 7 to 9 applicants. Could you tell us a little more about how this was conceived and how it will operate and how many people you think might enjoy its benefits?
We do see out there, because we have, through HOPWA, had an opportunity to make investments in housing for people with AIDS, a significant need out there to provide these kinds of resources. And we believe that that we can do this in a smart way through the use of this resource. It's fair to say that we would still need to formulate how these funds would be allocated, and would look forward to working with the committee and others as we do that. But there is no shortage of need with regard to serving individuals with HIV out there in the country. And I would just say as well that whether it's individuals with HIV or when we talk about Section 811 individuals with disabilities, what we want to do is we want to be able to provide opportunities for folks to live in a mainstream environment and have a good quality of life. And that's the purpose of this investment.
Your housing counseling assistance program, HOPE, I think there's $60 million for this program. Is that correct? I understand its purpose. It reduces delinquency rates, raises credit scores, lowers overall debt. I assume you've done some research on this. If you could share how well this has worked and what level of funding you really need to expand the program to meet all the need.
Yeah, so we're requesting $60 million for housing counseling efforts. It's a 28% increase over our previous budget. The reason for that is that we see, again, a significant need for this, but we also do have research that is on point that shows that to the extent that a borrower gets this kind of housing counseling, that they're less likely to default. And I just want to bring to your attention one study by NeighborWorks America in March of 2013 found that of 75,000 loans that originated between October 2007 and September 2009, clients receiving NeighborWorks America pre-purchase housing counseling and education were 1/3 less likely to become 90 days delinquent within 2 years of origination than consumers that did not receive that housing counseling. So all of this ties together to the extent that we can get this knowledge in the hands of borrowers through housing counseling, we can ensure that we have less defaults and that we don't get to the other end of the spectrum, which is properties that have been abandoned that are a blight on neighborhoods.
Thank you. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Cuellar.
Mr. Chairman, Secretary Castro, let me direct your attention to Colonias. I've been working on Colonia since I was in the state legislature. I passed pretty much the landmark legislation dealing with Colonias. It's, Mr. Chairman, it's Colonias or third world conditions on the U.S.-Mexico border. They basically don't have water, sewage, paving, electricity at times, and it's a very hard life for those individuals itself. Basically, what happened was that you had private land developers that came in, promised them, water, sewage, and all that. They got the money, and then they disappeared, or whatever happened, they went bankrupt. So, if you haven't seen a Colonia, I would ask you to take a look at it. It's really third world condition. So, on that, one of your proposals, and again, one of the submissions I turned into the chairman, but for the sake of the committee, you're suggesting that we move the 10% set aside to 15 for the southern states, and that, of course, will give the state on their own to, if they want to go, because I was involved at the state when we were working at the 10%. But can you explain a little bit more what your efforts are? And by the way, on the submissions I made to the committee, every place I could add colonias, I added colonias just in case that after the secretary, after you, will follow what your good work is on colonias. So I'm adding colonias and a whole bunch of effort. But I do want you to say a little bit about what you're looking at, the 10 to 15%.
Well, I know this has been an issue that you've worked on diligently over your career in public service, Congressman. And I know there's much appreciation for that. Right now, with regard to colonias, which are these communities basically in 4 states, Texas, New Mexico, Arizona, and California, of the CDBG dollars that go to the state. Now, remember that 30% of CDBG dollars don't go to local entitlement communities, they go to the state government. Of that money, right now, current law requires that 10% of those funds be allocated to the colonias. We are proposing that be moved up to 15% in collaboration with the state, that they could move that up to 15%. The approach is not one that mandates that, but asks that states be able to go up to 15%. And the reason for that is...
and I want to emphasize that, Mr. Chairman. It's one of my proposals that I submitted, but it's not a mandate. But let's say in my state, where we got a whole bunch of colonias on the U.S.-Mexico border, if the state of Texas, or in this case, Arizona, New Mexico, California, if they want to do it, they can go up to the 15%, but it allows the authority to do that. I just want to make sure that that there's no misunderstanding, just allows them to do that.
And I'll just note that right now, 3 of those states, Texas, New Mexico, and Arizona, are already at their 10%.
Right.
One state, California, I believe, is at about 5%, but that's because they only have 1 or 2 significant colonias there. We just see there that the living conditions and the needs are very significant, and states often do, I think, want to do more.
Mm-hmm.
This is one way that we would partner with them to allow them to do more.
Right. Thank you. Thank you, Mr. Chairman. I yield back the balance of my time.
Thank you, sir.
Mr. Secretary, let me go back to the issue of HUD's attempt to administer performance-based contracting, contractor funding as grants. You know, some of us believe, and I think a lot of us believe, that open competition is the best way to get the best value for the taxpayer, and Congress has been asking HUD to, in essence, follow the same contracting rules as other federal agencies. But specifically, again, since congressional intent has been, frankly, really clear on that for the last 2 years, and HUD, at least thus far, has not convinced the courts that you're right, will you follow congressional direction to recompete these contracts for 2015?
Yeah, well, you know, what we see, Mr. Chairman, is that, you know, we see that this can cost HUD less by using the NOFA process than by going down the procurement route. And that's one of our concerns, is that we believe that ultimately we can achieve a cost savings here.
I understand that, Mr. Secretary, but in the meantime, and again, I don't want to get into a debate with you here, but HUD's own analysis demonstrates that recompeting those contracts could save a ton of money. Having said that, though, just for 2015, I mean, I understand it might go to the Supreme Court, but will you follow congressional direction to recompete these contracts in 2015? I mean, so far the courts have rejected you, and Congress has been very clear as to what we've been asking to do. So I'm just asking, will you follow congressional direction to recompete those contracts in 2015 or not?
Well, I think it's fair to say that that we always want to live within the statute that governs us, but you know, we have been involved in this litigation, and it's an active matter of litigation, and so, you know, at this point we're waiting to see what happens with regard to that litigation on this issue.
I heard your answer. let me go into to the Energy Star requirements, and I keep hearing that those requirements, the Energy Star requirements, are making it difficult for SHOP grantees to produce affordable homes. Obviously, to the point that some participants in mostly rural areas are, I hear, leaving the program. So obviously the purpose of SHOP is to build affordable houses. And obviously controlling costs is key. So it seems that these requirements are adding thousands of dollars to the cost to build these new homes. These upgrades often do not increase the appraisal, so the cost comes straight out of the equity of the owner. And then other families are being disqualified altogether when build costs exceed those actually loan limits. And so how do you justify adding additional requirements that are now getting to the point that they're hurting families? The families SHOP is designed to help. I mean, I understand if it was, efficiency as an eligible expense, that's one thing, but they're not, they're requirements. So again, it's now at the point where it's actually hurting folks and not allowing people to have housing. So your thoughts on that? Are you looking at readdressing that to make sure that we're not, again, taking people out of affordable housing?
Yeah,
altogether?
we believe that we can accomplish both of these goals to encourage energy efficiency, but also, of course, to ensure that folks get the resources that they need to live in a quality, affordable place. And so it's been our experience that these two are not mutually exclusive. Now, you bring up what may be certain instances of difficulty. We're always willing to look at those instances and to follow up with you and the committee and figure out the best way to address those. But we do believe that marrying energy efficiency with our provision of resources makes a lot of sense. It makes a lot of sense to the taxpayer because the bottom line is often savings to us, and it often makes sense for the recipient of our resources because it represents a savings ultimately to them as well.
And one of the things that we should probably look at, and I'd like to work with you, is making it, families should have, potentially the families should be able to decide when those energy saving upgrades are worthwhile, or whether it's going to cause them more hardship than what we're, than not. So potentially making that an eligible expense might be the way to do that. So I look forward to working with you, because again, we are having folks who are now having problems. This is not hypothetical. So I look forward to working with you on that.
We'll be glad to visit with you on that.
Great, thank you. Mr. Price.
Thank you, Mr. Chairman. Mr. Secretary, I'm going to ask you to elaborate for the record on my previous questions about Section 202, Section 811, the effect of recent program directions that you've charted, as well as the budget proposal you're making, the impact of that on capacity and on the supportive services issue. I was interested in what you began to say about health care, both the costs and the quality of care available to people, particularly with respect to the 811 population. That's an important concern. And so if you could elaborate for the record your thinking on that would be helpful to us.
The reason that we're so enthusiastic about both of these programs, and now, mind you, of course, Section 202 has not had funding for new units in some time.
That's why I raised the question of capacity.
But we believe that we're hoping that through this demonstration project, to the extent that it's a successful demonstration project, and we demonstrate the link between this kind of housing with supportive services and savings for the taxpayers of other healthcare programs, that Congress will see the wisdom of investing again in the future more heavily in 202 or a program like it. Same thing goes for Section 811. Now, our request this year does include a request for 700 new units of Section 811. Here again, the issue is we believe that there's a cost savings to be achieved to the taxpayer by Section 811, and that there's a cost savings to Medicaid, to Medicare, This kind of housing is in line with Olmsted and is helping communities come in line with the Olmsted decision that requires essentially mainstreaming of folks with disability. So it makes sense from a cost savings perspective. It makes sense from a demographic perspective, because what we see is the elderly, the number of elderly in our nation growing tremendously, and the number of the folks who are disabled out there is so much greater than we have the need to meet right now, or have the resources to meet. Across the board, Section 202 and Section 811 investments make sense, and HUD requests with 202, $455 million for existing units and $10 million for this new demonstration project, as well as 700 new units in Section 811 funding.
Well, goodness knows the need is there for 811 capacity. It's a desperate need. There are also serious needs in terms of supportive services, as you well know, and this is a fairly diverse population where the same model may not always equally address the needs of that population. So that's why I'm particularly interested in the department's reasoning on this, both the trends that this program is taking and the funding requests as to what the impact is going to be, not just on a roof over one's head, but on that whole need for supportive services.
Yeah, and it's those supportive services that are truly the key to achieving the cost savings, we believe.
Cost savings and improved outcomes. That's a happy coincidence when it occurs, and it's very encouraging that we might be able to achieve that. Mr. Chairman, I guess I'll wait till the next round for my final questions, which have to do with homelessness.
Therefore, let's recognize Mr. Joyce.
I have no questions at this time. Thank you, Mr. Chairman.
Thank you. Let me go to another area. Again, we're charged with having to put together and market the bills. So the budget increases tenant-based rental system. The administrative fees were from about 1.5 billion to over 2 billion. It's a 32% increase, which is obviously a hefty increase for what some would call bureaucratic overhead at a time when our ability to house more tenants is pretty limited. We talked about that. So we're going to have to make some tough choices here. And I don't know how we can judge it. And by the way, I get that when I'm locally all the time, obviously, the locals, if they want that money. I get that. But I don't know how we can justify this increase for administration when obviously we all know that every increase must be matched by an equal, or frankly, sometimes even a greater reduction to actual programs. So what value added for actual needy households do we get by funding this level of PHA administration?
Perhaps the best way to put this is that that we're allocating billions and billions of dollars, $20 billion or so, through these housing authorities that we require to administer our programs in a professional, accurate, accountable way. And what we've seen over the last several years is a decline, generally a decline in the administrative fee that they are allocated. The impact of that is their ability to administer these programs as accountably, as effectively, as accurately as we would hope. That administrative component is important because it enhances the effectiveness of the rest of the resource. The difference in this request is that we're not flying blind. We actually conducted the first study of the optimal level of that administrative fee, what it really needs to be. And this request is based on that study. And I want to thank the committee for giving us the resources and the latitude to conduct that study so we would better understand exactly where that fee needs to be. That's what this request is based on.
And to the members of the subcommittee, that's one of those decisions that all these decisions that we're going to be facing. Do we potentially put almost $500 million into an administrative overhead, which, may be good or may not, but as opposed to putting it into, frankly, some more programs that help those in need. And so, again, those are some of the tough choices that we, unfortunately, are always forced with. So, and while I have a little bit of time, let me go into the Hagway. Oh, no, that's right. This is the one that Mr. Joyce already took my thunder. The early demonstration program, which after a year of proposing different plans, HUD finally now, and I'm very happy about that, in essence, smelled the coffee and is now proposing to undertake the demo within existing units, which I think is good. So HUD will use $20 million in prior appropriations and yet requests another $10 million in FY 2016 to fund the demo. So, Mr. Secretary, your budget states that the elderly program has more than $46 million in carryover resources. Now, wouldn't it be possible to use $10 million of this carryover to satisfy your 2016 needs for the elderly demo rather than another $10 million in appropriated funds?
I certainly wish that were the case. However, the resource need is for that $10 million that we request to be able to accomplish the demonstration project in a way that will be successful and that will give us the information we need. And what will be analyzed will be the extent to which this supportive housing for elderly individuals improves quality of life and also has or does not have the effect of reducing healthcare costs. And I would just say, Mr. Chairman, that we're very enthusiastic about this proposal because the long-run consequence to this can be so positive to the extent that we can make that link more firmly between housing for the elderly and the supportive services and figure out how we can drive down the cost
I get that,
in the future.
Mr. Secretary. The issue is that you have $46 million in carryover funds, and we're going to, and so why not use 10 million of those? And if what are you going to use those carryover funds for?
The challenge that we have is that those carryover funds are for renewals of existing units. That's why I say I wish that we had the ability to do that, but that money is for the renewal to existing 202 units. Therefore, we don't have additional resources unless we were to let go of some of those housing opportunities for senior citizens.
All right, and let me cut you off because I cut myself off as much as I cut off the other members. Otherwise, I hear from them later. Mr. Price.
Thank you, Mr. Chairman. Mr. Secretary, let me turn to homelessness programs. There's been a combined effort here, many different agencies as well as state and local partners, and we've made some strides. Certainly in reducing chronic homelessness, and veterans homelessness has been a focus. You might reflect briefly on where we stand on that. But I want you to describe a little bit further how this works and how it might work in the future. In particular, how does HUD work with the Interagency Council to End Homelessness to coordinate efforts on ending homelessness? I'm particularly interested in the interactions with the Interagency Council around the Veterans Affairs Supportive Housing, the VASH program. How are HUD and the Interagency Council working toward eliminating homelessness in especially vulnerable populations, children and families, for example? Part of the success we've seen with the Veterans Program, the VASH program, comes from the coordination of resources across federal agencies. For instance, in addition to the funds available for homelessness in our bill, the VA spends an additional $1 billion on veterans homelessness. Maybe that should tell us something about the kind of approach that's needed in other areas, and maybe there are things underway you can tell us about, or things you're contemplating, how HUD and other federal agencies are working to target resources to eliminate homelessness, particularly in children and families.
Yeah. One of the strongest success stories with regard to not just HUD, but a number of agencies, including the VA and HHS and others, has been the collaboration around USICH. We've seen, as you know, Ranking Member, 33% reduction in the number of homeless veterans. That has been made largely possible through HUD VASH allocation, But as you know, it's one thing to allocate the resources. It's another thing to ensure that that the resources are implemented effectively. That implementation has been made possible by strong coordination among all of the entities. I believe there are 17 or 19 of them that are part of the USICH. And I have had a front row seat to that regarding the coordination between HUD and the VA because we have the resource, but they have the case management, and making those things work requires that USICH involvement. You mentioned, you asked about, for instance, youth and families. HUD also works with HHS in coordinating efforts around their runaway homeless youth program and trying to get a common data management system in place there. So all of the pieces that go into implementing these programs successfully are run through that USICH. And I can tell you that each of the departments takes that collaboration very seriously and comes to the meetings prepared and with an overall view of how we can decrease and eventually end homelessness. And because of that, and the work of so many people out there in local communities, we are seeing the decrease that we want to see.
Well, thank you for that answer. I do think the degree of success we've had with respect to our veterans population may offer instruction as to how we proceed with other populations that are suffering from homelessness. We've had a particular focus on veterans, and that's as it should be. And politically, that has broad support, but it has required interagency coordination. It has required money. It hasn't come about just through good wishes and goodwill. And nor do I want to suggest that that job is done. I mean, there still is a veterans problem that must be addressed, but we have seen some headway. We've seen some of the things that can produce progress, and so I think it's very important to learn those lessons with respect to homelessness more generally.
Yeah. I very much agree, and that's certainly a large part of our approach with regard to the special purpose vouchers that we're pursuing, based on the lessons that we've learned with the HUD-VASH experience.
Mm-hmm. Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Price. And Mr. Secretary, thank you again for your time. It's always good to see you, and we look forward to continuing working with you. And obviously, a lot of us will have a number of questions for the record. I would ask you that that you and your staff work expeditiously to get those answers, please, and cleared and returned within 30 days. Obviously, those answers will help us craft the funding recommendations for the FYI 16 bill that we would hopefully start marking up real soon. So unless Mr. Price has anything else, I look forward to seeing you, Mr. Price, and the rest of the members again tomorrow morning, when we'll hear from DOT's Rail, Pipeline, and Motor Carrier Safety Administrators. Again, Mr. Secretary, look forward to working with you. Thank you for being here, and with that, we will stand adjourned. Thank you.